Hi, I'm doing my presentation on a cerebrovascular accident, also known as a stroke. So what is a stroke? A stroke is when blood flow to a region of the brain is obstructed, brain function deteriorates quickly, and leads to neurocell death. When brain cells die, brain function is lost, causing you to be unable to do things that are controlled by that part of the brain. So the prevalence of a stroke, more than 795,000 people in the United States suffer from a stroke each year. 610,000 of these are first-time or new strokes. So according to the CDC, every 40 seconds someone in the United States suffers from a stroke, and every 3.5 minutes someone dies of a stroke. So what are the risk factors of a stroke? High blood pressure. Any blood pressure over 140/90 can damage blood vessels that supply blood to the brain. Heart disease is the second most important risk factor for stroke, and individuals with diabetes are at a greater risk for a stroke than someone without diabetes. And smoking tobacco almost doubles your risk for an ischemic stroke. So the two main types of stroke is an ischemic stroke and a hemorrhagic stroke. So an ischemic stroke, it occurs when blood clots or particles block the blood vessels to the brain, cutting off the oxygen supply. And a hemorrhagic stroke occurs when the arteries in the brain leaks blood or ruptures. The blood that leaks from the artery puts too much pressure on the brain cells, which damages them. So stroke's effects on exercise response. Some studies have shown that stroke patients have significantly lower maximal workloads, heart rate, and blood pressure responses than controlled subjects during progressive exercise testing to fatigue. And oxygen uptake at a given submaximal workload in stroke patients is greater than in healthy subjects, possibly due to reduced mechanical efficiency. So one of the studies I found looked at peak heart rate in stroke patients during the completion of the Modified River-Maid Mobility Index, also known as MRMI. And the aim was to compare peak heart rates between stroke patients and healthy participants during the performance of the study and the tasks of the MRMI, and to determine if these tasks reach an aerobic level of intensity during training. And the results found that the peak heart rate attained during the MRMI tasks, except for rolling, by the stroke group was 50 to 60% of the age predicted maximum heart rate, which was significantly higher than the healthy control group during the transfer and walking tasks. So what are the benefits of exercise for stroke survivors? It improves cardiovascular fitness, improved walking ability and upper extremity muscle strength, and improves some aspects of executive functioning and memory, and could significantly lower the chance of having another stroke, since people who have a stroke are more likely to have a second stroke at some point in their lifetime. So for exercise, it lowers the fibrinogen and platelet activity, which fibrinogen function to block blood vessels to stop bleeding. It increases activity of nitric oxide synthase, and nitric oxide helps blood vessels dilate to prompt proper blood flow. It increases plasma tissue plasmagen activator, which works by dissolving blood clots that block blood flow to the brain. It lowers your LDL levels, which is your bad cholesterol, and it increases your HDL, which is your good cholesterol. It also lowers your triglycerides, and high triglyceride levels are a risk factor for stroke. It lowers your systemic inflammation and lowers your left ventricle hypertrophy, which is the thickening of the wall of the heart's main pumping chamber, which, if it's too thick, it may result in poor pumping action. So the management and meds for a stroke. So the most important thing for someone that's having a stroke is to get them help as quickly as possible. So the saying is be fast. The B stands for balance. Does the person have a sudden loss of balance or coordination? The E stands for eyes. Is your loved one experiencing double vision, or are they unable to see out of one eye? The F stands for face. Is one side of the face drooping? Ask the person to smile. If one side of the face isn't smiling properly, then that is a sign they're having a stroke. A stands for arms. Does the arm drift downward? Have the person raise both arms in the air. S stands for speech. Is he or she slurring their speech or having difficulty getting the words out right? Have the person repeat a simple phrase. And T stands for time to call and act. Call 911 and get the person a certified stroke center immediately. And some meds that help someone that possibly had a stroke is meds to treat and prevent blood clots. That blood clots could be blocking the blood supply to the brain, which is interfering with the oxygen flow. Antihypertensive drugs to lower blood pressure. An ACE inhibitor to relax blood vessels, and blood thinners, so that way blood can flow through the arteries freely. Benefits of rehab. Rehab is very important for someone who's had a stroke because they might have lost some function in certain parts of their body. So physical therapy can help a person relearn movements. Occupational therapy can help a person resume activities of daily living such as walking, personal hygiene, and dressing. And then a speech language pathologist can help neuromuscular re-education of the voice and swallowing muscles, cognitive language exercises to restore language understanding and communication skills. So for my case study, my client John is a 55-year-old male who recently got cleared for physical activity after suffering a mild ischemic stroke. Prior to his stroke, he received some of his physical activity from his occupation as a construction laborer and received the rest of his physical activity from doing resistance training 2 days a week. He is 5 foot 8 inches and 190 pounds with a BMI of 28.9. His HDL levels are 55, his LDL levels are 115, and a fasting blood glucose of 110. He currently smokes and has a blood pressure of 138/90 and a resting heart rate of 84 beats per minute. His father died of a stroke at the age of 54. So for his risk stratification, he's a high risk due to his age, his family history, him being a current smoker, him having a high fasting blood glucose level, and high blood pressure. So after getting to know my client, John, we discussed his 3 main goals. His first goal is getting his physical activity levels back to his pre-stroke level, since he did a lot of working with his hands at his job. He also enjoyed being outdoors since his job was mostly outdoors. He wants to lower his chances of having another stroke since he knows that people who've had a stroke are more likely to have a second stroke. And he wants to be able to bench 185 pounds, which was his pre-stroke 1 rep max. For exercise testing, individuals that suffered a stroke should undergo graded exercise testing with ECG monitoring. So we had John perform the YMCA submaximal cycle ergometer test, and the results are as followed. For body composition, since he's 5 foot 8 inches and weighs 190 pounds, that puts his BMI at 28.9, which puts him in the overweight category. For muscular strength, I didn't want him to do the 1 rep max test because that could be too much of a strain on him after coming back from a stroke. So we had him do the 10 rep max, and he was able to do 95 pounds for 10 reps. And for muscular endurance, we had him do the push-up test, which he was only able to do 3 push-ups, which is the poor category, which is understandable since he just had a stroke. And for balance, we had him do the balance error scoring system, which he had 31 errors, which puts him in the poor category, which is understandable since he had a stroke and he lost a lot of his balancing ability. So we'll get him a balance prescription to improve that. So for flexibility, we measured his range of motion in degrees at select joints. Most of his joints were normal ranges except for knee flexion, shoulder flexion, and elbow flexion were slightly below average. So for the warm-up, we'll have him do a warm-up prior to each workout at a light intensity, 30 to 40% of heart rate reserve for 5 to 10 minutes, just to get the blood flowing to the muscles. So we'll have him doing dynamic stretches that will get the blood flowing to the muscles that will be worked. For upper extremity exercises, we'll have him do shoulder shrugs and rolls, lifting arms forward and sideways, and passing a ball or hoop from side to side. For lower extremity, we'll have him do seated marching in place or marching in place next to a chair once his balance is improved. For aerobic training, we'll have him start at 3 days a week at 40 to 70% of heart rate reserved. And we'll have him doing 2 10-minute sessions with 3 minutes rest between each session for the first 4 weeks, and then progress to 3 10-minute sessions with 3 minutes rest in between. And we'll have him doing seated stepper until balance is improved, then progress to treadmill walking, and then eventually have him walking on his own outdoors since he enjoys being outdoors. For resistance training, we'll have him start on 2 days a week of non-consecutive days, then progress to 3 days a week after 6 weeks at 50 to 70% of 10 rep max. And we'll have him doing 1 to 3 sets of 8 to 15 repetitions for each exercise. So we're having him do a combination between body weight and machine exercises until balance is improved. And for each workout, we're having him do workouts that target the major muscle groups. So we'll have him doing sit to stand. We'll have him doing chest press machine, since one of his goals is to get his 1 rep max back to 185 pounds. Have him doing banded seated bicep curls, banded seated tricep extensions, leg raises, glute and hamstring bridges, and table towel slide to improve his shoulder mobility, since that was one of his below average range of motions. For flexibility, we'll have him do 2 days a week after resistance training is completed, then progress to 3 days a week after 6 weeks. So we'll have him stretching to the point of feeling tightness or a slight discomfort, and we'll have him hold each stretch for 30 seconds for 2 to 4 repetitions. And we'll have him doing static stretching for all major muscles. And for balance training, we'll have him start at 3 days a week at a moderate intensity, doing 3 sets of 10 to 12 reps, and we'll have him do movements to get him back to activities of daily living: heel raises, sidestepping, heel to toe walking, squat against a gym ball, and then progress to single leg standing, backwards walking, and weighted ball pass after 6 weeks. And then for the cool down, we'll have him do a cool down after each workout at a light intensity, 30 to 40% of heart rate reserve, just get his blood pressure or his heart rate back down. And we'll have him doing 5 to 10 minutes of light cycling, then progress to a light treadmill walking. And for exercise training considerations for stroke victims, we'll have them avoid the Valsalva maneuver during resistance training to avoid excessive elevation of blood pressure. Treadmill should begin at a slow speed at 0.8 miles per hour and provide harness apparatus for individuals' safety, or if needed, partially unloaded walking. And then a careful use of heart rate for intensity monitoring is recommended, as age-predicted maximal heart rate is rarely achieved by the stroke individual during a maximal exercise test. Exercise therapy should be initiated only after the individual is medically stable, and early onset local muscle and general fatigue are common and should be considered when setting work rates and work progression. So these are my references. I just want to say thank you for taking the time to watch it, and I hope you learned all about the benefits of exercise during for someone that's had a stroke.